you just mentioned a meniscus repair, and do you mind talking about your restrictions after meniscus repair? Because I know I've seen some studies in the fact that they do allow early weight bearing, and some surgeons are still doing the 6 weeks non-weight bearing. And you just mentioned a meniscus repair, and do you mind talking about your restrictions after meniscus repair? Because I know I've seen some studies in the fact that they do allow early weight bearing, and some surgeons are still doing the 6 weeks non-weight bearing, and some surgeons do the 4 weeks non-weight bearing. So I kind of want to get your thoughts on that.
No, that's a good question. So it's a little bit evolving. A guy named Dr. Leprade who was over in Vail at the time, he's moved now, but he basically came up with some data on meniscus root repairs. And so the meniscus root is where the meniscus is attaching to the bone. And he basically showed us, or he explained to us in a lecture, some data that he read from the Koreans as well, the Korean literature that showed that if you do early weight bearing in people with root repairs, they actually end up having more re-tears. The Korean surgeons went in and they started doing second look arthroscopy. They do this a lot more often in Asia. I don't know if it's easier for them to get consent or the patients are more willing, but they do a lot of the second look arthroscopy. So they did these root repairs and they would go back in and look. And they noticed that the ones that were weight bearing were having more re-tears at 6 weeks than the ones that weren't. So Leprade recommends, and he's kind of like the leader on root tears in the United States. He recommends 6 weeks of non-weight bearing. So if I do a root repair where I'm putting that meniscus back down into bone, I do 6 weeks non-weight bearing. However, if it's not the root and it's just a meniscus repair and it's like a vertical tear or a longitudinal tear, right? So it's in the horn of the meniscus, I repair it, the weight actually helps push that together as the hoop stresses push out when you put your weight on it. So I prefer my patients to bear weight after a regular meniscus repair. So I do full weight bearing is tolerated right off the start. What I limit though is two things. One, for the first 4 weeks, I limit range of motion from 0 to 90. I don't want them to get into deep flexion and challenge the repair until there's some scar forming. And then the second thing is I limit them from squatting past 60 degrees. So putting their weight down and bending into that repair for 3 to 4 months. And so those are the main two things that I limit. I don't limit weight bearing though. I want them to bear weight. It's going to actually help with the hoop stress. So the only time that changes in that 6 weeks that you're discussing is usually for roots. But what's interesting is a lot of the surgeons from the past or who are older than I, some of my mentors even, they do everyone 4 or 6 weeks non-weight bearing, even for regular meniscal repairs. So it's kind of an interesting concept, but you're definitely going to see as time evolves that we're going to start doing more and more non-weight bearing because of this data that Leprade's sharing about roots.
Cool. Yeah, I think even for me, every meniscus repair that I've seen is still 4 to 6 weeks non-weight bearing. Most are towards that 6 weeks. And when I think back to when I had my meniscus repair, I was 6 weeks non-weight bearing too. Yeah. And I think it's one of the easier things for me to relate to my athletes about, because I just tell them like, there's no way of sugarcoating it, but it just sucks. 6 weeks non-weight bearing is awful, but at the same time, you're looking at when you're 40, 50, 60 years old, you're going to be happy that you had that repair as opposed to them trimming it out when you are 18, 17 years old,
100%.
Yeah. So I think that's really, really cool that you were able to shed some light on that. And as far as like, are you able to discuss kind of like graft healing and what it means for rehab? Just because I've seen kind of mixed studies in regards to when the graft is most vulnerable. I've seen some that says like 6 to 12 weeks and then some that says 8 to 16 weeks. And can you explain kind of what that means as far as what we as PTs should be cautious of?
Yeah. So biologically, the graft doesn't incorporate into that tunnel from starting in between 6 and 12 weeks. So 6 weeks for things like patellar tendon because it's bone to bone healing. Okay. But for soft tissue to bone healing, it's closer to that 12-week mark. So between 6 and 12 weeks is for what the time it takes for the graft to start incorporating into the tunnel. But that doesn't mean the graft is mature yet. The graft doesn't actually ligamentize or mature until we're talking about between 12 to 18 months. A lot of the data that I've read is between 15 and 18 months. So from that time period where the graft is incorporating into the tunnel to the graft is actually matured, you still have a lot of vulnerability. The most important thing that we have to remember is that when we're sending these athletes out, that back to return to sport, is the most dangerous athlete is one who fatigues early. So these athletes who are returning at like 9 months or 12 months, the biggest problem that you have is they're going back and they're good for 20 minutes. They're strong, their muscles are strong enough, but now they're trying to play a 40-minute basketball game or something, and all of a sudden come minute 30 or 35, their muscles aren't their endurance isn't as strong as it used to be. So now they're starting to fatigue. Now there's more stress being put on the ligament, which hasn't completely matured. That's the danger, right? So that's why it's super, super important to not send them back until everything around that knee, right? The muscles, the hamstrings, the quads, the glutes, their hips, everything is strong enough so that they're not putting as much stress through that ligament. Does that answer the question?
Yeah, that does. And as far as like you said, there's different time periods. You mentioned the patella tendon is more so 6 weeks, and then hamstrings you're looking towards like 12 weeks or so.
Yeah.
Are there any rehab considerations that we as PT should be cautious of?
So that's where the whole open versus closed chain comes in, and that's why some docs are totally against the open chain until 3 months, is because they want to know that graft has already started to scar into that tunnel, so it doesn't get as lax when you're facing resistance. And that's why for patellar tendon, I'm less worried, because that bone-to-bone healing is more reliable incorporation early on than I would be for a soft tissue graft. But that's really what it is. That's the main thing, because if you imagine that graft, the endpoints haven't scarred in, you imagine the laxity can increase if you're facing resistance, right? Because what's an open chain doing? Imagine if you're doing a seat extension with a bar right in front of it, right? As you're pushing against it, right? That as your leg is trying to straighten out against that weight, what it's doing is it's pushing back against the graft, causing it to stretch, right? You're forcing your tibia, you're pulling it forward because you're straightening your legs. Your tibia is having an anterior drawer and weight's coming against it, and you're pushing as hard as you can, so it's possibly lengthening that graft. Does that make sense?
Yeah.
That's the basic fear. That's the whole reason why everyone's worried about that 6 to 12 week time. And some surgeons are totally against it, while others are like, there's data that supports going ahead and going earlier. It's kind of a tricky thing, man. I don't know if there's a right answer for that.
Yeah, I think the reason why I asked it just because, I've even some exercise with like, eccentric heel touches, and obviously the open connect chains are kind of the bigger ones that people are fearful of. And I just think back to if you just reflect on like a regular 17-year-old kid's life, and it's like what they're doing throughout the day, like they're not thinking about open connect chain. They're not thinking about, whether or not it's quote unquote safety going on stairs. Like if they feel good, a lot of times, like they'll start doing this stuff way earlier than they should. So that's like the balance that you have, is like, if they're already going to do it, should I just make them as strong as possible so they're safe? And it's I don't think there's a correct answer necessarily. It's just a matter of like trying to get them as strong as possible and keeping them safe through that, especially the healing time, like you said. It's just something I think about because, I have a range of athletes that come in the door. Some are a little more quote unquote reckless, and some are just more controlled, and they'll listen to every word you say. But then there's some that come in and be like, oh yeah, like I let's say it's 4 months out and I cleared them to jog for a little bit. They're like, oh yeah, I went for a 4-mile jog. I'm like, we never talked about this at all,
Oh yeah.
So I'm sure you've seen the same thing where it's like, oh yeah, I have knee pain now after I went a 4-mile jog. And it's like, maybe you shouldn't have gone for a 4-mile jog.
Yeah.
But
what's really funny. What's really funny is that I have some patients, like you said, especially the younger ones, they're just super energetic. They're strong. They're fearless. They're absolutely fearless. And I've never cleared them. And then I find out they've been playing basketball 5-on-5 with their buddies since month 6, which is terrifying me because, as you know, the data that shows that anything before 9 months, you have a higher risk of failure. So you're thinking about these athletes who are going back at 6 months and they're not ready. They can't even do a single leg squat for the life of them. They're shaking. Their femurs just dropping in. They have adduction. They have internal rotation. Their pelvis is unequal. They're totally unstable. They're totally a risk for failure, and they're doing it anyway. And then I'll kind of tell them, I give them the talk, you definitely don't want to do this. You're at a high risk. And then they see them, back a few months later. I'm talking to them. I go, so are you playing any sports? Oh yeah, I've been playing basketball for 2 hours a day still since I saw you last. And it's terrifying for me. But then a part of me is like, well, what's the point of clearing this patient? They've cleared themselves. There's nothing I can do. So then what I start doing is I start talking to them about, okay, they're going to do it anyway. I start talking to them about minute restrictions. So I'm trying to avoid that fatigue and that point where their strength endurance isn't lasting, and they end up failing because their muscles aren't doing their part, So I start talking to them about playing less, doing less minutes, because I know they're going to do it anyway. and they'll actually listen to that. And that's the only control I have. And you got to do whatever you can to control it anyway, you know?
Yeah, yeah. I completely understand that, just because it's tough. And I think for me, when I talk to them about the return to sport process, which is actually my next question, it's just it's got to be handled very delicately, obviously. And I try to explain, I try not to be all researchy, but at the same time, it does matter, because that's what the research is there for, is to try
Mm-hmm.
and give us best practice. And I also give them my personal experience, because I have torn both my ACLs. My left one is still torn now
Mm.
for 8 years. So it's like,
Yeah,
it does, I guess sometimes my words may carry a little more weight, because I have physically
totally.
been there. And
Mm-hmm.
I got cleared at actually 7 months to play in a basketball tournament.
Mm-hmm.
And sure enough, I actually ended up re-aggravating my knee.
Oh, wow.
It was the third game of the tournament. Luckily, it didn't re-tear at the time, but I had to go back in the rehab and kind of get strong again. And then I think I was back in rehab for another 3 months, which carried me to that 9-10 month frame, which is right now, at least for me, the bare minimum.
Thank you for watching today's video. Please feel free to like and subscribe and share it on your social media platforms. If you're interested, I have started an ACL Mastermind group, which is a growing library of content centered around ACL rehab. It has exercises ranging from immediate post-op to late-stage sports-specific movements and everything in between. It's a growing library and currently holds over 250 videos. There's content centered around assessments, movement breakdowns, exercise breakdowns, case studies, and a whole lot more. You also gain access to a private forum where you can engage with like-minded people, ask questions, share research articles, and share resources. If you're interested, please feel free to click the link below. Thank you for watching.